Welcome to the Paper Pro to Digital Hero presentation. My name is Laura Hall and I'm the Hospital Solutions Product Specialist for Quantum Solutions at Quest Diagnostics. I'm coming to you virtually from Nashville, Tennessee today. Thank you for having me. So to look at our learning objectives for today, as we look at what we want to achieve in the journey from paper to digital professionals, I want to share several tools that can aid you in that evolution. We'll first look at the transition from paper to digital by fully using your enterprise content management. We will then explore automated capture of that incoming data and take a look at electronic forms, and then we'll end by examining some access and insights. For those of you who have been in the HIM and clinical space for years, you're already pros at mastering the paper that you encounter each day. It was an HIM professional who produced the idea of a chart order, a patient chart order, and a process for allowing physicians to sign off on a record. And now both of those are available as electronic processes. So today we're going to talk further about the conversion to digital and some tools that can make that transition easier and more efficient. So when we think about the transition from paper to digital content, that used to just mean scanning in the patient's paper medical chart. But now that transition encompasses even more non-digital items, such as pulling off those attachments from emails and processing those using electronic tools within an enterprise content management system. Mobile phones now offer applications that integrate with your electronic health record, your enterprise content management, and also your ERP system, so maybe your Workday or your PeopleSoft. And we'll probably always have some degree of paper within an organization, especially those historical charts. There are certain anesthesia records that are used in the OR, and then patient-provided medication lists, things like that. So we're always going to have some paper, and these documents can and should be managed by your enterprise content management and then presented seamlessly to your clinicians within their electronic health record or their ERP, so they're not having to log into more than one system. Enterprise content management is described by AIM as the strategies, methods, and tools to capture, manage, store, preserve, and deliver content and documents related to organizational processes. And these are the exact tools that I'll be demonstrating for you today. I have a survey listed on this slide that you can take a look at later, and it reported the benefits of an enterprise content management strategy as being improvement in your workflows, seamless access to data, more enriched patient care, increased operational efficiencies, and then, of course, enhanced security. The first tool I want to show you will be intelligent data capture, and that's a process for taking in or ingesting all of these documents and data. As a nurse in the 80s, I remember all the paper charts and sitting and doing narrative charting and the HIM staff coming by, gathering and organizing all those charts. Then the coders would sift through and do their work. And then things evolved into checkboxes and on to electronic charting. And there was and still is paper generated, and much of that remaining paper is now fed into those high-speed scanners. Sometimes they have barcodes to identify the document type and or the patient, and sometimes they do not. So with a tool like Intelligent Data Capture, or IDC, we now have moved from being able to take in those documents and process them using optical character recognition and intelligence. And you're going to see that in a moment. So in this ingestion process, these documents could be coming from that high-speed scanner, from bulk scanning. Also, they could be coming from things like fax lines, watch folders, email attachments, or mobile device uploads. Once ingested, the documents are processed. The image is cleaned up. It can be rotated if that's needed, and then any blank pages are eliminated. Then the classification occurs. What is this document? Is it a history and physical, a medication record, an operative report? And so it assigns the document type during the classification phase. Next, it moves on to the extraction of the data based on your business rules. Database lookups are happening during the extraction phase to also validate those data patterns. So you're going to choose what information you want to extract per document type, and based on that rule, it's going to pull off that information. Following is a confidence-based validation. So you'll set up the confidence level, and if the extraction does not meet that level, the document will be presented to an analyst to validate and, if needed, to make any corrections. The last step is delivering the content to its appropriate place. So that could be your EHR, so your Cerner, Epic, Allscripts, Meditech. It could also be your enterprise content management, a business process management, or an employee resource program such as PeopleSoft, Infor, or Workday, or any other system that you have connected. So I've set up some documents to stop in the validation queue so you can see how it looks when human intervention is required, because we know in real life there's going to be those instances where you have low quality documents. Sometimes they have water or coffee stains and they've been scanned in or copied so many times that it's just hard to read. So we want to use intelligent data capture to process those documents. For this example of intelligent data capture, I'm going to be using Quantum Enterprise Content Solutions IDC solution, and I have 51 pages of clinical documents. Now I'm going to scroll through those here on the left side of the page, and you can see that these are all different types of documents. So when that 51 pages was dropped onto the bulk scanner or came in through a fax line, intelligent data capture broke apart those documents, did an optical character recognition from the top of the page to the bottom of the page to see where one document started and where it ended. It also classified that document. So here's an admission note history, here's an anesthesia record, here's a consent. These are all for different patients. So intelligent data capture has processed it to this point, and it's queued up some of those documents for validation. So anything with a red bar is being queued up to the analyst for validation. So we're going to start here with the admission note history. And I can see we have a medical record number. You can see it highlights on the page where it finds that medical record number. I can do the overlay so that we can see that a little bit bigger. But we can see that the account number is missing, and it says that the confidence level was too low, so it did not, attempt to pull that account number. It wants human intervention. So I'm going to pop this document out, and I can see the account number is there, but it has something drawn through it. So let me close that, and what I'm going to do instead of typing that in is I'm going to click on the screen where that account number lives, and it's going to pull that in automatically. Now that prevents me as a human from miskeying. And when I validate, you're going to see it's doing more of those database lookups and looking for Kathy Davis's records. So now we have her medical record number, her account number, also her admission and discharge date. So when I click validate, you're going to see that go from red to green, saying that that one's good to go, and it's going to jump to the next document in question. And so the next document in question is a certificate of death. And when I highlight over that medical record number, you can see that this field was set to forced review. And that means anytime a certificate of death comes in, we want human eyes on it. We want to make sure that all of these numbers match up. We want to make sure that the name is correct, that we're pulling all the correct information. Now, in this case, the analyst usually scrolls through to make sure we have physician sign-off, time of death, those type of things, before they validate that form. And then they just click validate, and it's going to hop to the next document with an issue, the next document in question. So this is doing QR kind of by exception. Our last document here is a well woman exam. It's a 5-page exam. And so I could scroll through that if I needed to, but I can tell pretty quickly what's wrong. We have the patient ID, but we have their last name merged in with that patient ID. So I'm just going to take Adams out, because this is for Amy Adams. And once I validate that by taking out her last name, it's doing those database lookups. Now it's pulled in Amy's name, admission and discharge date, her medical record number and that account number. And so then we can validate. And at this point, it's ready to go in and do that export. It's ready to deliver this information to whatever system we want to deliver that to. And that's what this box is telling me. But what I'm going to do is click cancel so that I can just show you some of these other documents. So here is a trial of labor after cesarean. So you can see in this case there are some barcodes. Barcodes are not required, but you can, of course, use those. Here's the medical record number here and the account number, so it shows that information. If we wanted to pull in a test date, so in the case of COVID, we wanted the system to pull test dates. So those extraction fields are based on your business rules, what you want to pull from that document. So we've looked at intelligent data capture for ingesting those documents. And now the second tool that I want to show you would be converting paper documents into intelligent electronic forms. For this demonstration of electronic forms, or e-forms, I'm going to be using Quantum Enterprise Content Solutions Registration Assistant. So we can see it's pulled over Mr. Robert Jones, our patient, his enterprise-wide master patient identifier. Some locations use this type of identifier. We also have his medical record number and his account number. Now I've already pulled in his insurance card and ID card and scanned in his advanced directives. So now we want to pull in that electronic form, which was once paper. And so we can see this is an outpatient services consent form. When I scroll to the bottom, we have a place where Mr. Jones can use that graphical signature pad and grab that initials. He can also sign the document. We have this configured where it automatically puts in the time, date stamp and the registrar's name. You could also have this configured so the registrar could sign themselves. Now we can see here it has his account number, his medical record number, his name, and his physician listed here at the bottom. Now when I click go, it adds that form to our registration, and I'm going to accept that we want to save that. And now we want to do a financial questionnaire. And so this is going to be a more intelligent electronic form because it's going to grab some other types of information. So here we've had it pull over Mr. Jones' information, his address, his city, state. We're going to add in his telephone number so the registrar can capture any information that's missing. You can see we have it configured to pull the last 4 digits of his social. And then we also have the form highlighted where we want the registrar to gather information. So she's asking Mr. Jones, are you interested in financial aid? He says yes, and it takes that highlight away so that she knows which fields to focus on. Number of dependents under 18, we can add that information in. Some of the information is already answered because it is included in his electronic health record. We want to gather the preferred language for his documents. He is an English speaker. If he was not, we definitely would want to have that captured so that we could communicate him in his language. And then what is his estimated monthly gross household income? Once I add that in there, I can submit, click submit. It's doing a calculation looking at his income versus the federal poverty level, what funds could potentially be available, and it's highlighting that and letting the registrar know that there could be some charitable funds available for financial assistance for Mr. Jones. So that is just popping up to let me know. I'm going to say OK, and we're going to save that financial questionnaire. Now you're going to see this again when we talk about business process automation, because this is just the beginning of a workflow for that financial aid for Mr. Jones. Now I do want to show you some electronic forms, some intelligent forms that were created by AHIMA and converted to electronic forms within Enterprise Content Solutions. So in these examples, we have a COVID diagnosis specificity form and diagnosis validation form. And as you know, a COVID patient's hospital stay can be very complicated, and the CDI professional may need to communicate back and forth with the clinician to fully understand the extent of the illness to properly code that chart. So some of you are probably familiar with these forms that AHIMA provides in the clinical setting by that CDI team, and they have a full library of forms, if you are not familiar, that were once paper and that have been made electronic. And so this really allows that clinician to interact with the form and send it back to the coder to expedite the processing of that chart for billing. So I've now shown you two tools for ingesting and gathering data. And now we're going to look at the tools to activate that data, and then a tool also to help uncover hidden information. I often hear HIM professionals and clinicians say they spend a large amount of time trying to locate a previous diagnosis, an operative report, or maybe pulling together records for research. So we'll end today with looking at an enterprise search tool. But first, let's look at some system integrations. In thinking about your ECM strategy, what we've seen over the years is that hospitals are really driven by two major systems, your EHR and your ERP. And your enterprise content management is just a complementary system that allows users to stay within the specific system where he or she spends their day, but to ensure that any external content is made available seamlessly to that user by the simple click of a button or a link. And that simple click brings forward that external content that's associated with the patient or with the employee in the case of an ERP. And your ECM strategy is behind the scenes queuing up that external content as needed. So I've heard this kind of compared to enterprise content management compared to an air conditioning system. When I'm at work, all I know is the air is cold. I don't know if it's a train or a carrier or a ream that's delivering that cold air to me. So when hospital systems and large ambulatory practices convert to a new electronic health record, they typically only bring in 2 years of data. And they strongly suggest and sometimes require that you have a highly integrated content management system to take in all of the miscellaneous paper that continues to be generated, in addition to housing all of that legacy data that you're going to need access to that's over 2 years old. So let's take a look at that. So in this example, the clinician wants to view a document. They're within their EHR where they spend their day. They find the document in the list in that electronic health record. There's a hyperlink, and they click that hyperlink, and that second view is that document being shown to them full screen. They don't know, nor do they care, that this document is being stored in their ECM. They access it seamlessly by clicking that hyperlink to view the image, and the end user stays in their primary system, in this case the EHR, and this scenario could work the same in a Workday or a PeopleSoft system. The HR user could click a hyperlink to view a performance evaluation. So your seamless integrations are very, very important. And as we continue to think about strategy, in thinking of workflows, converting those regular paper forms into electronic forms, as I showed you earlier, for consents or to begin a financial application, that's just the beginning of the process. Using these intelligent forms can be a part of a bigger workflow, and it can trigger a process automation. So this is what we call business process management, or BPM, the systemic approach to making a workflow more effective and more efficient. And on the next slide, you'll see the visual design tools that are used to achieve the specific goal for these particular organizations. So if we pick back up with that financial aid form that was started by the registrar to evaluate Mr. Jones' potential financial assistance, when he completed that form electronically in the registration office, his patient data was populated from the ECM. We gathered his patient language so that we could communicate with him effectively. You can see here the series of radio buttons and drop-down menus so that we can collect that critical information. This form was also configured to perform those calculations. Remember, it was comparing his income to the federal poverty levels and the assistance that was available. And it alerted the registrar of potential eligibility. So it's already an intelligent form that we're interacting with. But this form also, as part of this business process management, was routed to a financial advisor's work list. And they can take that form on the iPad to the patient's bedside to help complete the remainder of that application. Once that financial advisor gets that form completed on that iPad, it can be routed to a supervisor or a series of supervisors for approval or denial of those charitable funds. So in the second view here, you see the supervisor clicking the link, and it takes that supervisor to a document where they can review and sign off or deny those funds. So in this example, this original process was 13 very manual steps. Sometimes it took weeks to determine eligibility. And once they added that business process automation, it took that down to 6 automated steps with an often immediate decision for those funds. But also, even the more complicated cases cut it down to about 48 hours versus weeks. And some EHRs do offer a similar financial assistance process, but this type of automation, of course, could apply to other processes. For example, in the clinical space, this client needed a process to pull all of those outpatient therapy orders from their fax lines and get them scheduled in a very timely manner. So by adding process automation, they set up those fax lines to feed directly into intelligent data capture, process those orders, and then drop them into a scheduler work queue. So the scheduler can then view the original order next to the information that's been extracted. They can have access to the physician's office information in case they need clarification and need to fax something over to the physician for another level of care explanations. And then they also have access with the information to call the patient and get that therapy appointment scheduled and secured in the EHR. And you see that here as that third visual. So the original order and the data extracted are all stored within that enterprise content management system for future reference. So as you can see, a business process management is a really great way to activate those workflows that have several time-consuming steps by adding that automation, adding that electronic routing of approvals and calculations, or any other process that's very manual. I've seen this used for document retention processes, for forms on demand, and managing lots of other inbound documents. So now I want to stop and switch gears a bit. We've talked about ingesting the data, storing the data in our systems, and now I want to talk about locating that data within your enterprise. Now, of course, your structured data is usually the easiest to locate, but I'm guessing that your organization has additional data that's what we sometimes say is below the surface. So it's unstructured data. It's data located in your legacy system, in a text, an image, maybe a PDF file that was originally a PDF and then it's been scanned several times, or even maybe audio or video files. So let's say a clinician calls the HIM department and needs to quickly locate historical cardiac records for a patient. The patient says she was here several years ago, she had some sort of cardiac procedure, but she's not a great historian because she's having chest pain. In this case, we're going to look at an enterprise search tool. I'll be using Quantum Enterprise Content Solutions Deep Search to demonstrate this on how you could search across your enterprise with a Google type search. So in this case, for the Jennifer Jones, who came into the emergency room with that chest pain, she knows she was here a few years ago, had some sort of procedure on her heart, is not quite sure what she had done. We have put in cardiac and her medical record number with the word "and" in between. That's going to kick off that Boolean logic, so it's looking for both of those things. And when I click enter, it kicks off that search. And you can see it pulled in one of 5 entries, or this is the first of 5 entries. So it shows us all 5 of those entries. And I can add in other columns as I want to. I like to add in a name column so that we can see these are all for Jennifer Jones. Well, the first entry is a cardiac cath report, most likely what she had done, and that was in 2016. So that kind of lines up with how many years ago she said she had some sort of procedure. And so I can see the first page of that document, but if I need to get that to a clinician, or a clinician wants to log in to that enterprise search tool themselves, you could kick this, from an EHR directly into their chart if you needed to. I can toggle through those pages and see that full screen. So let me scroll down a little bit. And so you could toggle through those pages to see what you needed to see from that cardiac cath. Now I can see at the top of the page here, this is for Jennifer Jones. Here's her medical record number. Here's her account number. Maybe I want to go straight to that account, and I want to just look and see what her EKG strip looked like on that admission. And so I can pull that up. So I've got access to her full chart. I can also go over to her related charts and folders. So any other events where she has been in the hospital, I could have access to those very, very quickly. So that's how you could quickly find those cardiac records for Miss Jones. Now, let's say you had a specific cardiac incident that you were looking for. So I'm going to put in supraventricular tachycardia and, because I want it to look for both of these things, a specific medical record number. And so we're looking for the content of those 2 words together, supraventricular tachycardia and the medical record number. And we can see it's highlighted in those results. We have a pediatric patient who was admitted with that issue. So I can open that. And here we say, this patient, 4-month-old, presented and with supraventricular tachycardia. So it's looking for those 2 words together. So that's how the search is kicked off. Now, we also have people that use this in the research area of their hospital, and I'm going to show you some of those advanced search options in this case. So I'm going to put in 2 chemotherapy agents. We're going to say a researcher needs to pull the records of all the doctors that have worked with these 2 agents and that physician. We're going to use our demonstration doctor. And then I'm going to go over here to the advanced search options. Now this is where you can search just your clinical area or your full enterprise or just your non-clinical area. And then we know in this case, they call these records research records. And so I'm going to pull in research record as that document type I'm searching. So carboplatin, doxetal, and Dr. Demo. When I click off that search, it's going to pull back research records that have those 2 chemotherapy agents and that physician listed. So you can see we've got 5 entries, 5 different patients who have all received this chemo regime. So if I'm a researcher and I need to pull all 5 of these charts, I could go through here and work these charts and get the information that I needed. I also have the option anytime to download an export of that. So maybe I just want to save that and open that in an Excel spreadsheet. And then, of course, I could just walk away knowing I need to pull, Mr. Weiss, Ms. Folger, Mr. Smith, Jones, and Morris's charts as a researcher. So you always have that option as well to just pull that by an Excel spreadsheet. Or you can work with it, straight from this information here. So if I wanted to pull, Mr. Jones' research record, maybe I just want to go straight to that account and open that up. And it's going to show me, here's Mr. Jones, and he's one of our favorite test patients. It's going to show me all of his records that are related to that. So we've got lots of information. We can also get to his related charts and folders. And he's one of our test patients that has a lot of previous visits within our system. So when we think about digital data, I cannot end the presentation without mentioning security. Security is always top of mind when we talk about medical data, and it should be taken very seriously with your enterprise content management strategy. It's important to be able to manage your security by groups, but also at the individual level or even the document type level if that need arises. And this allows you to run reports easily and routinely, and also immediately if you were to suspect a breach within your walls. So let's think about that full organization. So as we look at the digital transformation across the enterprise, this is kind of a high-level view of a typical health system. Your enterprise content management is a big investment as part of that system and should be used across the organization to its fullest capacity. So we've talked about the ECM strategy to provide that seamless view within your EHR, using it in the registration office, using it in the financial aid office, the HIM department, but it can also be used in other areas, human resources, accounts payable, contracts, and on and on. So I hope this helps you think of ways that you can use your ECM to expand the footprint on your journey from a paper professional to a digital hero. So let's recap. Did we cover all the objectives? We talked about how important it is to choose a content management system that automates the process from end to end. So providing that engine to consume those inbound documents, analyze, classify them, extract the data, and deliver that content and its data to its assigned resting place. That could be your content repository, your electronic health record, your line of business system, or a workflow or business process. And then using those intelligent electronic forms bundled with the workflow to add that efficiency. So any of those processes that are really labor intensive are a really good candidate for a business process management solution. And then bundling all of that with an enterprise search can help you further identify trends, patterns, reduce those blind spots, and locate that data that's stored in those legacy systems. And when I think about the clients that I have personally worked with, I think about one of our HIM managers in the Canadian space, and she commented that using these types of tools had turned her very tenured paper-based team, her paper-based HIM team, into true digital health professionals. And they found the system very intuitive, and implementing it had increased their job satisfaction because they had all of their tools that they needed at their fingertips. And what a great compliment that was. I would like to take this opportunity to thank everyone for attending this session. You can reach out to me at the contact information listed here if you have questions about the presentation or if you want more information about Quantum Enterprise Content Solutions. Thank you again and have a great day.